Actual.
Now we will do the tuning fork test. There are two types of tuning fork tests. You have your Webverse and your Heent test. Webverse test is to check for lateralization, and while Webverse test is to compare air conduction with bone conduction. So this is your tuning fork. So this is the drum, that's the fork, and then the handle. Okay? So we use the 256 cycles. So to set the tuning fork to motion, we hold it here. Okay, not here. Okay, so we hold it at the handle, and then we set it to motion by doing this. Okay, or we can hit it in our knuckles to set it into motion. So before we do the Webverse test, we have to ask the patient, meron bang problema sa tenga?
Wala naman.
Wala naman. So, okay. So you have to ask your patient if there's any problem with the hearing. Because that will matter later on. Okay? So you will instruct the patient that for the Webverse test, you're going to place the tuning fork in the midline. Okay? And then the patient will tell if he hears the sound equally on both sides, or is it louder on one side. Okay? Okay, so ilalagay natin dito. Tapos tingnan mo kung maririnig pantay. Okay. So set it into motion. Okay, pantay.
Yes po.
Magkabila, okay. Okay. One more time. Okay. Okay, so the normal Webverse test is there should be no lateralization. If it lateralizes to the abnormal ear, the one that has problem, usually that indicates that there is a conductive hearing loss. Okay? If it lateralizes to the normal ear, then it means that there is sensory neural hearing loss. Okay, now we do your Heent test. So Heent test, as I mentioned, is compares air conduction with bone conduction. So our instruction to the patient is, I will put the tuning fork here at the back, and then you will tell me kung hindi mo na, if you don't hear it anymore, I will place it in front of the ear. So normally, he should still be able to hear the sound when I place the tuning fork close to the ear. Okay. So we will set it into motion. Okay, naririnig. Pag wala na, sabihin mo. Meron pa?
Yes.
Okay, so one more. Wala na?
Wala naman. Yes.
Okay, so he should still be able to hear that. Again, on the other side.
Wala naman.
Yes. So meaning air conduction is greater than bone conduction.